guys, it's Hina Sheth here at Rebalance Physical Therapy, and I want to talk to any of you who might be experiencing pain, discomfort, and tightness in and around the hip, the groin, the lower abdominal area, and even in the saddle or perineal area after having some type of hip surgery. Now, at our clinic here at Rebalance Physical Therapy, we are physical therapists that specialize in spine, hip, and pelvic issues, either randomly or after having some type of a surgery. And what we typically have been seeing quite a bit of is clients coming into us that are having these types of symptoms after undergoing surgery that they thought was going to be a quick fix to their issue, but they still end up having other either secondary issues or the issues that they were having. Some of them were improved through surgery, but other ones actually worsened. And so I want to give you an example of a few clients that we've had that after they've had some sort of hip surgery, they started experiencing tightness in the inner thigh. Now, this is not just limited to inner thigh for some of you. It could be in the back of the thigh. It can be down in the hamstring area. But for this example, I'm going to use the inner thigh. So inner thigh tightness, discomfort, also saddle and perineal discomfort and tightness, and almost feeling like there's pressure and a golf ball in the rectum. So what could be going on? Now, what many of you may not realize is that there is a group of muscles within the pelvis called the pelvic floor muscles. And some of you may have heard of the pelvic floor, but I have lots of other videos that explain what the pelvic floor is, so I don't want to get into the nitty-gritty of it. If you do actually want to learn what that is, I have other videos that you can click on to learn about that. But just to make things easier and to show you what the pelvic floor is, and again, I'm going to use a female model over here, but this is the muscles of the pelvic floor, okay? So if this is the pubic bone and this is the tailbone, here are all the muscles in this red area of the muscles within the pelvic floor. And for men, I know this is a female, but again, if you just cover up this area, it looks exactly the same for a male. You have this very, very similar musculature, actually same muscles of a female and a male. So with a couple of minute differences. But anyway, you guys, if you can just kind of not pay attention to this area and look here, these are the muscles of the pelvic floor. And you can see these little white kind of branches that are coming in and off. These are nerves that go in and through this area. These muscles of the pelvic floor actually have attachments into the hip. So anytime someone has a hip surgery, it can most definitely affect these muscles that are in and around the saddle area. And if it does and it affects the nerve, then many of you can experience anything from bladder changes to pressure in the saddle area to potentially even numbness or burning sensation and a feeling of fullness or tightness in this area, especially when you sit. So that can be why you might be experiencing that after hip surgery. And hip, any type of surgery, is considered trauma. And so that can actually traumatize some of the muscle in that area. And if you already potentially had issues that were starting in that area, and many people have pelvic floor issues, but they have no idea because they weren't symptomatic. But then having some type of surgery in and around this area can traumatize these muscles and kind of stir up basically stir up that area and create tightness and pain and discomfort in that area. So that's one area. The other thing that can happen is you can start having this discomfort into the thigh region. So we're going to use the inner thigh as an example. So again, anytime you have some sort of surgery in this area, you've got lots of musculature, okay? So say example, you had a hip surgery and maybe they went in through the front of the hip, or maybe they went into the side of the hip, but they basically had to do surgery somewhere in and around this groin area. So you can see, here's your abdominal musculature right in through here. Here are all of the front hip musculature. These are called the hip flexors. And these are the inner thigh muscles called your adductors, okay, the inner thigh muscles. That's a lot of muscle in that area. So if you have trauma in this area, again, such as surgery, right, these muscles can get tight, they can spasm, and they can create discomfort in and of themselves just from the muscle. But sometimes if you peel back the layers of these muscles, you also have nerves that go through this area, okay? Nerves is what gives sensation as well as function, meaning contraction and relaxation to these muscles. If these nerves start to get involved, and what I want you to think of is, if you have a plant in soil, and so you have the roots that are going through the soil, that's kind of what these nerves are inside of a muscle. It's kind of like roots going through soil or nerves going through muscle. And so if those muscles are tight and spasm because of going through trauma, they can actually affect the nerves that kind of run through that area. And when you have compression or any type of, pressure on nerves, that can give you sensation and pain and discomfort and burning and all sorts of different things, tightness down the leg. Because a nerve, if you press on it up top and compress it, it can actually give you symptoms further down the pathway of that nerve. And so again, I'm giving you an example of something in the front, but this can easily happen in the back of the leg too. You've got nerves that go in the back of the leg. So I hope that clarifies for some of you that have had hip surgery, hoping it was going to fix everything, but now you're starting to have other discomforts. What could be happening? So now that I told you what potentially has happened, what do you do about it? So really what you do want, who you want to see is you want to see a really good pelvic floor, orthopedic, physical therapist to really treat this if you're having symptoms in this area. Usually someone that understands how to treat this in a holistic, integrated fashion, meaning they understand not only how to treat the pelvic floor, but they also understand how to treat all the external musculature in the joints, okay? This is where orthopedics falls in, as well as pelvic floor falls in. They need to understand how the two function together and be able to treat it together, and that way they can get you on the path to better alignment, to better healing, to decrease the spasming in these muscles, and to get you on the right path of when to integrate strengthening as well as stretching at the appropriate time so it doesn't create more irritation on these nerves. And it allows, again, the muscles to calm down, the nerves to calm down, which should basically decrease your pain and then eventually get you on the path of functioning better and getting you back into your normal routine. Now, sometimes this doesn't happen overnight. Sometimes people feel like, hey, I just have physical therapy for 2 to 3 visits and that should solve it. It doesn't, because sometimes there's much more complexity than you think, especially if you've had issues prior to even having your surgery. So how do you find this person that is going to get you on the right pathway? Well, if you live in and around Philadelphia region and area and the surrounding suburbs, it's a no-brainer. This is what we treat day in and day out. Come see us. You can come to our website. It's rebalancept.com. That's rebalancept.com. We have lots of other YouTube videos and helpful information on our website. You may even qualify for a free consultation, especially if you are thinking of coming in for treatment. However, if you do not live anywhere near us, we know we have a pretty good idea of good physical therapists by name in certain metropolitan areas. If you live in a small remote area that is not close to a metropolitan area, then we might be able to kind of help you find the resources to maybe find someone in your area, or maybe you can go to a close metropolitan area. So I hope that information was helpful to you and you have a better understanding of what might be happening. Maybe this video is helpful to even be able to communicate with your current physician that you're seeing. So in any way, shape, or form, I hope it leads you to your right path to healing. Have a wonderful day. Take care.